Hi, I'm Debbie Turksan, physical therapist and craniosacral therapist in the New York City area. I'm talking today about tailbone pain. I see lots of patients with tailbone pain. They come to me with stories like 10 years ago I fell down a flight of stairs and I've had pain ever since around my tailbone in sitting or when going from sitting to standing or when lying on my back. Or when I was a kid I slipped off my roller skates, or last winter I slipped on some ice and I landed on my bottom and it hasn't felt quite the same since. After I sit for a long period of time, I need to get up and move around because the tailbone feels stiff. Or a patient may say, I had a difficult delivery of my baby and I've had a lot of tailbone pain ever since. It feels like there's a lot of pressure around the tailbone, or almost feels like the tip of the tailbone is poking back as if it could come very close to or through the skin. Patients with tailbone pain don't always have a history of fracture. Sometimes they do, but often what will happen is if someone injures their tailbone, they'll go to their doctor and the doctor will take an x-ray and they'll say, your tailbone is fine. You've just had a hard fall and you have some bruising. Give it a few weeks and you should feel better. And if that doesn't happen and the patient returns to their doctor, the doctor may not have many more options for them. They may prescribe pain medication, which just masks the problem. And basically the patient is left without a course of action and with this pain. And I've seen folks that have had tailbone pain for months or years and never really knew of any options for treatment. And sometimes it can be really limiting in terms of activity and ability to work, and it can be really depressing. So I wanted to show you a few things about tailbone pain today in this video, and if any of this resonates with you, I encourage you to find a physical therapist in your area who can do direct treatment to the tailbone. Often they would describe themselves as a pelvic floor physical therapist, and we'll talk about that more in a minute. So that's what you would search for if you're looking online or if you're calling your local clinic. You'd be asking for a pelvic floor physical therapist. So a quick look at the anatomy we're talking about here, just to give you some context. This is a pelvis. This is a female pelvis. This is the front, and this is the back. In the back you can see the two lowest bones of the lumbar spine, and this is the sacrum, and this is the tailbone, also sometimes referred to as the coccyx. You might have heard your pain described as coccydynia, which just means coccyx pain or tailbone pain. And in this model it's great because you can see all the muscles that attach to the tailbone. So if we see that the tailbone is here, all of these red structures are muscles that attach either directly or indirectly to the tailbone. So the tailbone just doesn't sort of hang out at the end of your spine in free space. It has quite a few structures that attach directly to it. So if there's an injury to the tailbone, like in a fall or at a car accident, it's not just a question of whether or not the tailbone itself is bruised or pushed out of its normal alignment, but there's also the question of the muscles around it that can go into spasm, that can further pull the tailbone out of alignment and can also create pain on their own. So now if we just look at the sacrum and the tailbone, so we'll pull that out of the pelvis, and that was the special effect 3D section of the video. Hope you didn't miss it. This is the back, and we'll look at it from the side. So you can see that the tailbone normally has a bit of a curve and sort of points forward towards the front of the body. And there's all joint here between the tailbone and the sacrum, and there's usually a little movement in that joint. And we need that because when we sit, for example, the tailbone will sort of tuck underneath a little bit, and then when we stand, it'll sort of extend back to its normal position. And so sometimes in a fall, if you land on your tailbone, the tailbone can get pushed forward and stuck in flexion like this. Certainly not necessarily to this degree, I'm just exaggerating so you can see it. But it can get stuck forward. It can also get pushed back. Sometimes during childbirth, the tailbone can get pushed back into extension as the head of the baby comes through nearby. And of course it's not always that clean, so it wouldn't just necessarily be in flexion or extension. It can be side bent, or it can be rotated, or it could be a combination of these. And again, it's definitely not necessarily to that degree, I'm just exaggerating to make it easier to see. So then not only can the tailbone be in the wrong position, but as we saw, the muscles that attach to the tailbone can go into spasm when the alignment of the tailbone is not where it should be, and that can make the problem even worse. So what can a physical therapist do about this? Well, first you need to make sure that you're working with a physical therapist who's trained in assessing and treating the pelvic floor, which is the area of muscles and joints that we were just looking at. A pelvic floor physical therapist has the ability to get a hold of the tailbone and the muscles around it in such a way that we can loosen up any muscle spasm and correct the tailbone alignment. Not every physical therapist is trained in those techniques, which is why I'm stressing that you want to find a pelvic floor physical therapist. I'm a physical therapist that's trained in pelvic floor therapy, and I treat coccydynia quite a bit. I'm also trained in something called craniosacral therapy, which is a nice combination because after the tailbone treatment is finished, I'll have the patient do a sit test and a sit to stand test to see if the pain is any better, and then I'll also usually do some craniosacral techniques to the pelvis and the spine, which will help the body sort of integrate any changes that have happened and also sort of calm down any symptoms that might have been provoked by the treatment. So I wanted to offer this video to make you aware that if you have tailbone pain, you have options. You can see a physical therapist. And if you're in the New York area, I'd be happy to talk with you to see if this kind of work will be helpful for you. And if you're not, again, please look around your area for a pelvic floor physical therapist that might be able to help you. And know that also, even beyond physical therapy, there are some doctors that specialize in treating coccydynia, where for some more stubborn cases, they can offer injections or other procedures. So don't stop looking for help, and definitely make sure that your first stop is a pelvic floor physical therapist. Okay, any questions, feel free to shoot me an email. Thanks.